final program proposal will be on Lincoln County, Missouri, a rural county in northeastern Missouri, directly north of St. Charles County and borders the Mississippi River. It's about 50 minutes northwest of St. Louis, and in 2015 had an estimated population of just shy of 55,000. The sex demographic in the county was split nearly 50-50. The racial demographics were predominantly white, 97% identified as white, 2% identified as black, 0.5% identified as Hispanic, and the other remaining 0.5% identified as mixed races. 25% of residents are under 17, 23% were reported as between 45 and 64, and nearly 13% were over the age of 65. 20% were in their 30s and 40s, and the remaining 10% was split between infants and college-age residents. 14% of the county is reported to not have a high school diploma or equivalent. 43% have a high school diploma or equivalent. 20% have some college but no degree. 10% have an associate's, 11% bachelor's, and only 4% have a master's degree. When assessing the need, county health rankings and the least favorable indicators noted older adult depression, primary care provider access, adult smoking, cancer rates and chronic illness, and inadequate social support as all areas of concern. Older adult depression was chosen as the final program proposal because the indicators mentioned in the previous slides are all risk factors for developing depression in old age. Lincoln County has a high percentage of seniors, and with baby boomers coming of age, we wanted a program in place for them. There are many risk factors associated with developing depression in older adults. Some of the biological determinants include being female, having a physical disease that manifests with age, such as Parkinson's, medicines such as corticosteroids, and a family history of depression. Individual behaviors that contribute to older adult depression include living alone, cigarette and alcohol use, and mismanagement of medications. Lincoln County has a high tobacco use rate and a high alcohol use rate, and also has many seniors on medications for chronic illness. Health service determinants that impact depression in older adults include those who receive treatment, the lack of access to mental health care, primary care physicians who are poorly trained in mental health, and the assumptions that older adults will self-report their mental health concerns. Some social factors that affect depression in older adults include disconnections of social interactions, divorce or separation, low education level, economic hardships, loss of a spouse or close friend, poor sleep, excessive stress, or stigma against mental illness. Public health and mental health officials are working more closely together to address depression in older adults. Programs such as PEARLS and IMPACT are making their way into local communities, and policymakers are trying to change Medicare policies to cover depression and mental health care. 15 to 20% of older adults in America struggle with depression annually. Many of them do not seek a doctor because they do not have insurance and cannot afford the high medical costs. Lincoln County has higher than average medical costs and a 9,000 to 1 doctor-to-patient ratio. Although Lincoln County has a much higher rate of mental health providers of about 1,500 to 1, 55% of older adults report seeing their primary care physician as their first doctor of contact for their mental health needs because of the insurance and costs. In addition to the lack of primary care providers in Lincoln County, a needs assessment showed that cancer rates for seniors in Lincoln County were higher than the surrounding counties, and more seniors lived in nursing homes and medical facilities for their mental health issues. Although Lincoln County is a rural county with a small population, it has the convenience of being directly next to St. Charles County, which is the #1 health-ranked county in the state, and it's only 45 minutes away from St. Louis, providing a lot of regional resources. Some big players in the assets and stakeholders in Lincoln County include the Mercy Hospital Network, the SSM Medical Group Network, both which have networks in the regional St. Louis area, Kreider Health Center for Mental Health, and the Lincoln County Health Department. 8 objectives were created to help decrease depression in older adults in Lincoln County. I will discuss the 3 that I think will have the most impact to the senior residents of Lincoln County. By 2020, cigarette use by adults 65 and older in Lincoln County will be decreased by 25% to the Tobacco Cessation Program and the Missouri Tobacco Quit Line between May of this year and January of 2020, evaluated by the number of people reporting smoking with self-reporting surveys. By 2018, 10 nurses in Lincoln County will be trained in mental health care through the American Psychiatric Nurses Association through the APNA certification classes and training between May of this year and next, Evaluated by the number of nurses trained in mental health care by the APNA certification credentials. In the next 12 months, adults 65 years or older in Lincoln County who visit their doctor annually will increase by 10%, done through rural transportation systems and the LACOA Care program between May of this year and next, evaluated by the number of elders self-reporting through self-surveys, doctor's office data, and Medicare claims.